Assalamu alaikum. Good morning, everyone. My name is Moktarul Islam, who worked in ICDRB for over 7 years, especially in maternal and childhood division. Now I'm work with International Online Journal Hub in Dhaka. Now I'm going to talk about my research topic, perceived mental stress and associate factors, a comparison between employed and unemployed infertile women in Bangladesh. Thank you for this opportunity to make an oral presentation. First of all, I want to define the infertile woman. Infertile woman is defined as women who are trying to get pregnant and for 1 year or beyond, but yet to get pregnant. Evidence shows that infertility is the most stressful condition for couple who desire children, and which is further aggravated by the social stigma and isolation and other factors. A few studies investigated the physical, psychological impact of infertility in Bangladesh, but no study examined the relationship between employment status and perceived mental stress among infertile women in Bangladesh. Based on existing information, we formulate our research questions, which was what are the difference between perceived mental stress, perceived mental stress between perceived mental stress and employment status among infertile women in Bangladesh, and identify associate factor contributing to increasing level of mental stress. To answer our research questions, we formulate our objectives to compare the prevalence of perceived mental stress between employed and unemployed infertile women in Bangladesh, and identify associate factor contributing to increasing level of mental stress. There are two important parts of this objectives. One is comparison of perceived mental stress between employed and unemployed infertile women, and another thing is the associate factor of perceived mental stress. Our figure 1 displayed how we conclude in respect of comparison. Here is between perceived mental stress and employment status. And figure 2, conceptual framework showed that different variables like socio-demographic, behavioral factors, infertility related factors, how influence the variable of perceived mental stress, and ultimately which affect the perceived level of infertile women. Our study, based on our objectives and research questions, we conducted a hospital-based comparative cross-sectional study between March and December through purposive sampling technique. We select our study site purposefully at two health facilities in Dhaka. Center one was the inpatient and outpatient Department of Reproductive Endocrinology and Infertility in Bangabandhu Sheikh Mujib Medical University, and another center was Infertility Service Unit in Mohammadpur Fertility Service and Training Center. Our study population, we recruited a total 122 infertile women consisting of two groups, employed and unemployed group, with 61 in each group. Figure 3 displayed how we recruited our study population. A total 152 infertile women participated in our study, primarily after obtaining consent form, we administered our screening questionnaire, and finally we recruit 61 to. Here is our tools we use: approve informed consent, infertile women screening questionnaire, a semi-structured questionnaire consisting of 2 sections, and perceived mental stress range was 0 to 40. Lowest stress we considered less than equal to 20, and highest stress greater than 20. Static and data analysis, we used Stata 13, and descriptive stress we calculated mean, frequency, and other parameter, and independent sample t-test and cascade test were performed to compare the two different variables. And finally, bivariate and multivariate logistic regression were performed. Comparison perceived mental stress among infertile women, 56% of employed and 44% of unemployed women are suffering from high level of perceived mental stress with no significant differences. Our table shows that also there is no significant in our crude odds ratio. Associate factor with perceived mental stress, in our analysis we found that different variables are associated. Place of residence, Hindu religion, and women higher education, husband, secondary. These are our associate factor with perceived mental stress. And we conclude that the present study provides evidence of high mental stress, perceived mental stress experienced by infertile women in Bangladesh, irrespective of their employment status. Thank you.